Welcome to Life Through a Woman's Eyes. I'm Rosa Russo. On this program, we are going to discuss a disorder called trigeminal neuralgia. We are going to hear from two women who have experienced the disorder. Joining us to discuss the issue are Dr. Michael Brisman, a board-certified neurosurgeon who is proficient in adult neurological surgery. Dr. Gad Klein, a neuropsychologist who specializes in cognitive aspects of various neurological disorders. Both doctors are associated with St. Francis and Mercy Medical Hospitals, among many others. Giovanna Little, Executive Director of the Leslie Munzer Neurological Institute of Long Island, and our guest clergy will enlighten us with a spiritual reflection, showing us that with God, all things are possible. All this and more on Life Through a Woman's Eyes. It is estimated that 1 in 15,000 people suffer from trigeminal neuralgia, but the actual figure may be significantly higher due to frequent misdiagnosis. TN is a rare disease which has specific unique features and is considered by many to be the most terrible pain known to man. It is not easily controlled and there is no cure, but some people may find that treatment provides partial relief. Treatment may include medication, injections, surgery, or a combination. We have with us two patients who have experienced the condition with effective treatment and want to reach out to people suffering from the disease so that they can live their life pain-free.
I first realized I had trigeminal neuralgia would be about 5 years ago. I had thought that it was sinus pain. I thought it was my teeth. I had gone to various doctors. I had gone to an ear doctor. Then I had severe dental work done, and the pain would go into remission, but then in a few weeks and a few months, it would come back again. And I couldn't understand why this pain kept reoccurring.
The first time I realized that something was wrong was 3 years ago when I was experiencing extreme pain on the right side of my face and a flashing up in the upper roots of my teeth. So I went to my dentist and she refilled the cavity, and a month later it actually put me pain medicine, and a month later it went away. And for 3 years I didn't have anything. And then October of this past year, October 2010, that's when the pain came back. And this time it was much more intense.
In most cases, trigeminal neuralgia is more common in females than men, and symptoms begin appearing after the age of 50. Although there have been cases that patients with trigeminal neuralgia were as young as 3 years of age. Because of the variety of treatment options available, having trigeminal neuralgia doesn't necessarily mean you're doomed to a life of pain. Doctors usually can effectively manage trigeminal neuralgia. Dr. Michael Brisman specializes in stereotactic and radiosurgery techniques for the treatment of brain tumors and trigeminal neuralgia. Dr. Brisman has authored numerous articles and books in the field of neurosurgery. He tells us what trigeminal neuralgia is.
Trigeminal neuralgia is a disease that causes terrible face pain. It usually affects adults, often the elderly, and the pain is excruciating. And people often do not know what it is that they have. They often think it's dental disease, but they know it's very terrible. This is an MRI super magnified view of the trigeminal nerve where it comes out of the brainstem. This is the part of the brainstem where the nerve comes out of the pons, and this is the trigeminal nerve as it's coming out of the brainstem here. And what you see is that here there's a little blood vessel crossing the nerve there that's just pinching the nerve. And in this particular person's case, that was presumed to be the cause of her trigeminal neuralgia. The most common cause of trigeminal neuralgia is a small blood vessel, an artery or vein, pressing against the trigeminal nerve as it comes out of the brainstem. The second most common cause is multiple sclerosis, and people with multiple sclerosis can get it because of that disease, demyelination disease, and rarely it can be caused by other masses that press on the trigeminal nerve, such as a benign growth or tumor.
It is an invisible disability because people with trigeminal neuralgia don't appear in a wheelchair, don't carry a cane with them, but they suffer all day long with excruciating pain in the face.
What caused my trigeminal neuralgia was the trigeminal nerve, which stems from the base of the brain and spinal cord, was being compressed by an artery, and that was causing the extreme pain, almost like a stabbing pain.
I don't know if anyone is really aware of what causes it, why women mostly have this condition, why women over 50 have it more than men have it.
Patients with trigeminal neuralgia, the main features are pain in the face. It's almost always the same side of the face and often the same part of the face, like either the cheek or the jaw. The pain is sudden, severe, excruciating pain that comes on quickly, goes away pretty quickly, and is often triggered or set off by light touch, talking, chewing, a light wind.
It would almost sometimes be an electric shock going to the upper roots of my teeth. And I'd have it for about a few minutes, then it would go away for about 30 minutes, and then 3 minutes it would come back in intensity, and then it would go away for 30 minutes. So that's how it would work.
Oftentimes, if the trigeminal neuralgia is near the eye socket, they can have a feeling of crawling also that urges them to scratch their eye.
You are unable to go out into, if it's a windy day, go out into the wind, certain foods that you eat, putting on makeup.
It's diagnosed mostly by the history, so it's the kind of disease that can really be diagnosed over the telephone. On examination, patients are usually normal unless they have had prior treatments or they have a tumor or growth, but almost all patients with trigeminal neuralgia on examination are normal.
Usually it's diagnosed when the patient is in extreme pain. Very often they'll go to their dentist or they'll go to their primary care physician, usually we'll then send them to a neurologist who asks them does a comprehensive interview and asks them specific questions about what triggers the pain, what sort of pain it is, where the pain is, and usually using those questioning methods along with MRI of that area of the brain can elicit the diagnosis.
My diagnosis of trigeminal neuralgia was through an MRI that my neurologist had sent me for. After I had the MRI, I was then sent to Dr. Michael Brisman, a neurosurgeon at Neurological Surgery.
I first did go to a neurologist, and by then I had actually done extensive internet research and Googled right side of the face pain or extreme pain on the side of the face, and actually was directed to trigeminal neuralgia. I read the symptoms and I said, wow, of all these symptoms, I practically have almost every single symptom. And I know sometimes the internet's not always full of every information is true, but I think it's really helpful, and it's very important to be proactive and do your research and find out, what you might have or not.
Surgery should be considered if patients are not getting adequate pain relief with medical management, or if they're getting good pain relief but they're having bad side effects from the medicines. In either of those two cases, a surgical procedure can be considered.
I had some hesitations about the procedure until the very end, when I just couldn't take the pain any longer, and I agreed to have it done.
The surgery wouldn't have been my first option, so I first wanted to see if maybe medications could work. So I was on an anti-seizure medicine, but it really didn't help. But for some people, it really is helpful, and that's all that they need. But in my case, after a few months of being on the anti-seizure medicine, the pain wasn't going away, and the pain is so debilitating. So then, after more careful research, I said surgery would be the best option, and that's when I had the decompression microvascular surgery to hopefully solve the problem as opposed to mask it.
There is a small incision behind the ear on the affected side of the face. We remove a small piece of the bone, the skull bone, and then we bring in a microscope and look directly at the nerve and the blood vessel. We don't have to cut through any brain to get there. We just look right at it. And when we see it, we move the compressing artery or vein away from the nerve and interpose a small piece of a pledget, or what's called Teflon felt, and that's it. Then we put the bone back, close up. The person usually has to stay in the hospital about 2 days, and often for that, the pain relief is often immediate, and that operation really has the best chance of being curative.
No single test can diagnose trigeminal neuralgia. The condition must be distinguished from other forms of facial pain that may be caused by diseases of the teeth, jaw, or sinuses. When we return, we will continue to speak with our guests who are willing to share with us how they have successfully treated their condition. Dr. Michael Brisman, who has authored numerous articles and book chapters in the field of neurosurgery. Dr. Gad Klein, who has published numerous articles in peer-reviewed journals in both cognitive and molecular neuroscience. Giovanna Little, Executive Director of the Leslie Munzer Neurological Institute of Long Island, and our guest clergy will enlighten us with a spiritual reflection. Stay with us on Life Through a Woman's Eyes. Welcome back to Life Through a Woman's Eyes. I'm Rosa Russo. Depending on the stage of trigeminal neuralgia, many sufferers may not present any outwardly noticeable symptoms, though some will exhibit brief facial spasms during an attack. Some physicians will see psychological root causes rather than a psychological abnormality. Many TN sufferers are confined to their homes or unable to work because of the frequency of their attack and side effects. Dr. Klein, who is an expert in advanced neuroimaging techniques such as functional MRI, as well as water test and electrocortical stimulation mapping, explains the social consequences or psychological effects of trigeminal neuralgia.
The social consequences, psychological effects of TN can be quite enormous, actually. Very often patients get incredibly anxious because even the smallest amount of contact can trigger a significant pain reaction. They very often don't want to go outside on windy days. They don't want to participate in activities that their family members are participating in, and they can tend to withdraw from social life, from family life, and from stuff that they used to do in the past, which has an enormous effect on both their lives and on the lives of the people who are living with them.
Furthermore, the medicines that we often give them can also have side effects. Particularly, they may feel their memory isn't so good. They feel like they're in a bit of a haze, or their thoughts are foggy. They may be unsteady, particularly the elderly. The effects of all these things in combination is often to cause patients to have extra anxiety, extra depression, and difficulty coping with a very difficult problem. So there can be very serious social and psychological consequences of this illness.
The disease itself is often referred to as the suicide disease. These patients cannot socialize outside of the home because simply going to a restaurant like I can do or you can do is not an option for them. A ceiling fan can blow on their face and cause them pain, excruciating pain for hours.
A lot of people that saw me didn't even know all the pain and suffering I was experiencing, because I do a good job of masking things, and I always went to work, and although I was suffering, I didn't want to complain to anybody. So a lot of times I suffered alone or only to my close family and friends.
The role of a neuropsychologist or a clinical psychologist in trigeminal neuralgia very often comes in once the diagnosis has been made, once the patient is living with chronic pain. Sometimes after the surgery or some sort of intervention, most of the time beforehand while they're still trying to work out medication effects. Cognitive behavioral therapy can be very effective in minimizing or at least modulating the pain that the patients are feeling, and perhaps most importantly, helping them deal with how to cope with the pain, how to think about the pain, and how to think about their lives with the pain. There are multiple reasons to get a psychological evaluation in patients with chronic pain, especially with trigeminal neuralgia. One is to assess their mood. Patients who are in chronic pain, especially pain of this nature, which is quite severe and debilitating, can really become significantly anxious and depressed. And to screen for that is very important. Patients can, in certain cases, if the pain is unremitting, can have thoughts of suicide, and that's something that needs to be addressed very, very quickly and very proactively as well. The other reason to do a psychological evaluation is to assess what we can do to make this patient's active life, functional life better, how they can deal with the relationship with their family members and their friends, and then from the other side, how their family members and friends should deal with them and deal with the pain and deal with the differences in their life.
I think the objective in the evaluation is to try to assess what are the person's problems, how much of the problem is the trigeminal neuralgia, how much is other problems like anxiety or depression, which are also common in the population and may be caused solely by the pain syndrome they have, but may have pre-existed and are being exacerbated by that. They can also assess, is this person being properly managed on medicine? Do they need to consider a procedure? And do they need more social support, like a support group, to help them through a difficult time in their lives?
There are many people who complain of pain syndromes, and they often have a psychological cause. The vast majority of patients who are complaining of pain are really experiencing pain, and to dismiss it, based on a psychological cause, or to tell them it's all in their mind, is not only damaging from a psychological standpoint, but very often from a physical standpoint, because they're not getting the treatment that they actually need. The problem is patients who are in pain very often look normal. They look like any other person walking down the street, and to just assume that they're faking or lying for some other reason is most of the time quite unfair to the patient.
The pain that you have with trigeminal neuralgia is a very real pain. It's a pain that you know that you're experiencing, but you don't know how to relate it to other people or tell them about this pain, because of the intense impact of the pain, and because of the length of the pain, and because you go into remission. You can have the pain for maybe a week and then go into remission for months.
I knew that the pain in my face was not just in my head or psychological, because it was such extreme pain, and I knew it was something to do biologically with something on the side of my face or something nerve-related.
Specialists in neurology and neurosurgery often collaborate to determine the most appropriate trigeminal neuralgia treatment to relieve each patient's pain while avoiding facial numbness and other long-term risks. Although drugs are sometimes effective treatment, surgery may be required for permanent relief from the pain. Surgery is considered effective for cases that do not benefit from medications. Giovanna Little is passionate about helping families faced with neurological disorders. Her responsibilities as executive director of the Leslie Munzer Neurological Institute of Long Island include administration, fundraising, programming, and strategic growth of the Institute. A TN support group is one of the 6 groups that she facilitates. She explains the importance of a support group.
Support groups are important because they provide a safe environment to individuals suffering with diseases and for their family members. In the support group, patients can interact with other patients and share their concerns, their feelings, discuss what types of medicines that they take, what are the side effects of these medicines, what type of pain do they experience, what types of foods cause or may cause their pain, and other issues.
It's also very important for family members to see that there are other family members who have learned to deal with the change in their loved one's lifestyle, and to teach them how to cope with what's going on. Very often people feel kind of alone and isolated. They don't run into other people who have trigeminal neuralgia on the street, in the store. A formal, support group gives people an avenue and an opportunity to meet people who are going through the exact same situation as they are.
When sometimes you feel alone because of illness, you really feel alone not only by yourself, but you also feel that your faith has left you and that no one's around. But it all goes back to that Jesus has told us that as long as we love one another, there'll be those who will help us. And that's why support groups, and they're so helpful and they're so strengthening, and we're so thankful that we have them all around us.
Support groups of any kind are always helpful because then people know that they're not alone, that they're not suffering, and there are other people that are going through this, and they could lean on each other and even take advice from each other and develop friendships with other people who are suffering the same.
My goal for the Trigeminal Neuralgia Support Group is to provide the community with education about trigeminal neuralgia. And when I mean education, we're talking about educating individuals who may have experienced pain in the face and have not been diagnosed yet. And we're talking about educating physicians so that they may diagnose trigeminal neuralgia earlier. And early diagnosis leads to earlier treatment and leads to less suffering for the patient.
Prognosis, I think, is excellent. If the illness is properly diagnosed and the person sees appropriate specialists, we have very good treatments for this disease. Sometimes the symptoms can be properly treated and symptoms can recur, but then we can repeat one of our treatments.
In many patients, they have an excellent recovery with surgical intervention, and they're pain-free. In some patients for whom either surgery is not appropriate, it can depend on how they react to the medication, how they cope with what they're going through, their mood, their support system, the psychological counseling that they get.
I had the surgery 9 days ago, and here I am being interviewed now, and I feel terrific. From the minute I woke up from the surgery, I touched the side of my face, and I didn't feel any of that pain that I had been experiencing for the last 6 months. This is 9 days after having the decompression microvascular surgery, and I feel terrific.
Faith played a big role during the time when I had trigeminal neuralgia. My faith helped me get through this horrible facial pain.
You always put faith in God, you put faith in the surgeon's hands, so you always do things also with leaps of faith.
Faith can play a very, very big role in how people cope with pain and how people cope with illness and sickness, especially chronic illness and sickness.
If you are diagnosed with trigeminal neuralgia, there are a lot of good treatments available for you.
If you or a friend know of anybody with trigeminal neuralgia, obtaining appropriate psychiatric and psychologic assessment is critical.
If you feel that you have trigeminal neuralgia, do a thorough research and then go to a specialist within that field.
If you or someone you know has trigeminal neuralgia, it's important for them to attend a support group.
According to literature, the only non-destructive procedure that reliably eliminates trigeminal neuralgia symptoms is microvascular decompression, which aims to remove the identified cause of the condition by relocating or removing the blood vessel pressing on the nerve and causing pain. Microvascular decompression surgery is about 95% effective, with a low risk of pain recurrence or side effects such as facial numbness. Microvascular decompression offers the best potential for long-term relief or cure of trigeminal neuralgia pain. The procedure is not intended to damage or destroy any part of the trigeminal nerve. Here now is a spiritual reflection.
Jesus has promised to always be with us, even in the most difficult of times. And it's important for all of us to realize that when we go through suffering and when we go through our crosses, that He wants us to bring those crosses to Him. And so when we hear it, all of us around those who have certain type of crosses, we're there to help them to get through it. And that's what we're all about. to help us during the joys and the sorrows that are in our life. And as we hear someone who does have a challenge, it is our responsibility to help them to grow and to get over those challenges by strengthening them, by loving them, and by giving them a strong hope. So as we listen to Donna and Laura, let our prayers be that we're there in helping them in so many different ways. And if prayer is the only way that we can privately, let it be. And so as we continue to keep Donna and Laura in our prayers, may I just leave you with this final thought. Father in heaven, through the love of your Son, Jesus, who has showed us how to accept his cross, help us to embrace our challenges in this world, and by accepting them, you show us through your love that we are in the joy of your resurrection, which is our resurrection, and we ask this all in your name. Amen.
Having faith in God is immensely helpful when suffering a painful condition. Faith does matter and is an important part of our lives. The good news is that successful treatment for trigeminal neuralgia allows patients to resume an active life and no longer has to be controlled by fear and pain. I'd like to thank my guests for joining us and sharing their story. Thanks to Dr. Michael Brisman, Dr. Gad Klein, and Giovanna Little for their expertise. Thanks to our guest clergy for enlightening us with a beautiful and spiritual reflection. And thank you for watching the show. Join me again next time when we examine another issue that women face on life through a woman's eyes.